An expert team set up to look at the findings of the CAST report and decide if those findings should be implemented in Scotland has delivered its recommendations. The CAST report, chaired by Dr. Hilary Cass, was commissioned by NHS England to look at gender services for children and young people. Well, we're joined by our health correspondent, Lisa Summers. Lisa, the first thing we should point out is that these recommendations came out on Friday when much of the focus was elsewhere. Can you remind us about the background to the CAST review?
That's right, Laura. The Scottish Government had been under pressure to publish its response to the CAST report, something that it said initially it was going to do before the summer recess, but then said it couldn't because of the election. And that's why we've seen this first report come out the day after the election result. Now, Dr. Cass looked at services for children in England on the back of a rapid rise in the number of children questioning their gender and also a long waits for treatment at the only specialist gender clinic, which was in London. Now, Dr. Cass found that children were being let down. She said in part that was because of a toxic debate around gender. She said that children deserved much better, a much more holistic and broad, widening approach to gender services rather than being targeted down one specific service. But she also said when it came to the use of puberty blockers for very young children, that there was very weak evidence on the long-term use of puberty blockers. And so for that reason, outside of clinical trials, she was recommending that they be paused for children in England.
So what are the recommendations for Scotland?
Well, you might recall that proved to be quite contentious. Some people originally questioned the science behind that decision, despite the fact that it was proven that this is the best data available. And you might also recall that the Scottish Greens refused at the time to see whether they backed the CAST review. What we're seeing now is a group of expert clinicians who've looked through the recommendations, the 32 recommendations that Hilary Cass made, and have said that pretty much all of them apply in Scotland. So they are recommending that we see much more use of mental health services for children within gender services, things like counselling for things like neurodivergency as well, things like ADHD. So that's what they're recommending, but they're also saying that puberty blockers should not be used outside of clinical trials, as is happening already here in Scotland and as is happening in England. Now, those recommendations have to be taken back to Parliament in the autumn. They will be debated. And the report's authors say that even if the recommendations are accepted, it is going to take several years for them to be implemented because it requires training new staff, finding new staff. And that will, of course, mean an anxious time for the many children, over 1,000 children who are still waiting for a first appointment at the Sandiford Clinic in Glasgow.
Lisa Summers, many thanks indeed.